where you talked about coming into your office and all the different modalities that work toward making us whole. And I was in a few months ago, well, when we first started, I went to see Stephanie to do the KES machine. The KES machine measures frequencies going on, and it picked up some belief things that were going on in my mind that were limiting me. So I immediately made an appointment with Charlotte, went through the emotion codes, went back to Stephanie for supplementations on the other thing the KES found. It's like, it's a one-stop shopping. It's wonderful, right? Got adjusted by Doc, and I tell you what, you guys, it is worth it. It's worth every penny. Okay, I just want to let you know. I'm also a client. And now we're going to hear from Dr. Goolsby. We've just learned to love him so much, and he is a true man of God, man of the community. He is a people-loving person. So you're going to enjoy hearing from him. Dr. Goolsby.
Thank you for that, Allison. We're good? Okay. Yeah, I didn't know they were going to show that video, but that was perfect timing, because that's going to save me trying to stumble through explaining quantum physics, because it's vast. She did, that was marvelous. That was really good. If I've seen that video, it's been a while, but that was really quite amazing. For y'all that don't know, I'm Dr. Goolsby, Grady Goolsby, and let me see if I can get this.
It turns on the side button. Okay, good.
Okay. So I just want to give you a little bit of my story and a little bit of my history before I get into what I want to speak on here today. I've been a chiropractic physician. That's my traditional training for over 40 years now. It's like hard to believe. It's been like a blur, but it's just been an amazing journey. My primary focus in my practice is, and you've heard a little bit about it, and we're going to go in a little bit more into the different modalities that we're doing, but my primary focus, although I was traditionally trained in chiropractic, is now functional medicine. Some people would call that nutritional medicine. My website's drgoolsby.com, very simple, and we're going to refer to that a little bit more later on in some other things. So, as I said, I was traditionally trained as a chiropractic physician, but I always had an interest in nutritional therapies. You know, when we were young, my brother was here, when we were young kids, and maybe a lot of y'all experienced the same thing, every time we had a sniffle, we were taken to the pediatrician, and we did a shot of penicillin. That was it. That was our basis of how you treated sickness back then. You know, my mom, I would get a sniffle, I would dread her, I would actually remember her picking up the phone, and I would be listening. Is she going to pick up the phone and dial that number? And then I got to go down there and get this shot. You know, and it was crazy. But that was our paradigm of the day. So I went on, we'll come back to that story a little bit more, because that progresses. So we went on to pursue, after my formal training, a lot of graduate education, did hundreds of hours of training in functional medicine. I actually even worked in a medical facility for 7 years where we practiced what we call metabolic medicine, which included IV chelation, which they don't do a lot of that much anymore, where we used to do IV chelations for removing blockages in arteries and that kind of thing. That was kind of the treatment of the day. Now we know how to do that a much simpler way. We don't have to go through getting all the needles and getting stuck all the time. Like I said, my current practice includes traditional chiropractic care, advanced upper cervical chiropractic, which we're going to talk about here in a few minutes, contact reflex analysis. You already saw a demonstration of that with Rochelle. Bioenergetic testing. We use a machine called the CAS4 machine that Allison referred to. that's really good at identifying abnormal energies and so forth in the body, and also can help us identify impediments, which we're going to talk about impediments to healing here in a little bit. Also functional medicine, also known as nutritional medicine. Some people call it complementary medicine or alternative medicine. I've also written a book. The name of the book is Aging Well. And it's about intermittent fasting and eating properly, okay, which is a very good basis to start, for those that are not, to start on this journey of getting more oriented into natural healing and using the things that God has given us to be healthy versus relying on pharmaceuticals. And we'll get more into that in a minute. The book was kind of inspired by a couple of things. I'm not a writer. I guess I am now, but I wasn't before that. I never liked writing. I didn't even like writing essays in school. You know, I was that adverse to it. But what drove it was a couple of things. Through my career and my practice, you know, you see people, I've been in practice long enough, you see people progress through their lives. And I saw it also in my parents and my in-laws as well, that there was this kind of pattern where I noticed that it seems like everybody kind of went through this thing about spending about the last 10 years of their lives dying of something. You know, they live healthy, and then all of a sudden, like this light flip switch, or the light switch flips, and they begin to die. And you've heard people make the statement, well, you got to die of something. I've heard pastors say that. You know, you got to die of something. Well, who wrote that rule? You know, Moses lived to the end, and strong, Caleb, and these in the Bible, they did their work until they were done, and then they were done. And then they went on. They didn't have to die of something. But this world is basically set up that way. You know, you get into the thing, oh, now I got diabetes, or now I've got heart disease, now I got cancer, now I got high blood pressure, whatever. And then this begins this carousel. And then we get into this mindset. We heard about mindsets and beliefs and all that last night. We're going to get into more of that in a minute. So I said, there's got to be a better way. And kind of around that time, another doctor I know pretty well had written a book, and he referred to this study that they did over in Europe. And through water fasting, they would call it water fasting over there, we call it intermittent fasting over here. Water fasting, they were reversing type 2 diabetes, which our traditional training over here, medical and even chiropractic, was, no, that's not possible. That's something that's happening in the body, and it just is what it is, and we manage it the best we can. And that's what we're going to do. So I was like, wow, this is, you mean there's a way we can reverse diabetes? So I went and looked at the studies and everything. They're published studies, and it's true. And I went like, well, where or who's doing that in this country? Where can I get this information? I want to know more about this. And I looked and searched online, and I couldn't find anything. And I finally found a guy in Toronto, Canada, named Jason Fung, who was a nephrologist. A nephrologist, if you don't know what it is basically a guy that does dialysis, primarily for most people that their diabetes is so bad in their body it has destroyed their kidneys. Yeah. All right, and we saw our dad kind of go through that situation, and he was writing about this. So I started digging into what he was doing. I couldn't find anybody in this country that really was writing on it or doing anything. So I said, well, I need to let my patients know about this. So the book started as a couple of sheet handouts, and then it was kind of a manual, and then we just wrote the book, and the book has become kind of a manual for people to start their journey in the natural health realm. So I would encourage you all to get a copy of the ones. I know a lot of people in here probably already have it, but I'd encourage you to get a copy of that and to look into that. And I'm going to explain in a minute a little bit more, give you a kind of synopsis of what we talk about in the book. So I want to kind of give you, we're going to do a little healthcare flow chart here of kind of what medicine and alternative healthcare flowing eventually into what we really all want to be in is divine health and divine healthcare. All right. So the first layer of the healthcare flow chart we'll call crisis medicine. Allison was in crisis medicine, so she knows about this. This is where you've been in an accident, you've had a heart attack, stroke, fractures, acute poisonings, emergency surgeries. This is where I believe medicine does its best work.
Yes.
You know, you've been hit by a car and you got bones sticking out all over the place or whatever, then you don't want to be in my office.
Yeah.
Okay, you need to be in an emergency room, right?
Right on the question.
Right, yeah. You're not going to need the questions at that point. Yeah, that's right. Okay, so the next layer of healthcare, let's call it, is traditional medical treatment. This is where a lot of people are at. We've been there, I've been there. You know, you have a stomach ache, you have infections, a headache, allergy relief. You go to your doctor and you go, hey, I've got this problem. And what do? They typically write your prescription or give you an over-the-counter, something to get over the counter. This is where, you know, if you walk into a pharmacy, there's rows and rows and rows of over-the-counter remedies, right? Cold remedies, flu remedies, aches and pains and remedies and all that those kind of things. So that's the next layer. Okay, then we get into another layer called medical management. These are where you've got some of these more chronic, ongoing diseases that have been diagnosed in you. You know, you might have diabetes, you might have kidney disease needing dialysis, bariatric surgery, that's your people that are got, you know, these obesity problems that they do surgery, some kind of surgery in the gut to basically all that is a medically induced fast is all it does.
Exactly.
That's what it is. But there's a lot of side effects to that as well. You know, high blood pressure, heart disease, allergies, mental disorders, aches and pains. Generally we think of, we're going to change this a little bit, but we generally think of these kinds of issues are not curable in the medical world. They are to be managed, and what an industry that is, right? Think of the industry of that
Think of the money.
management,
Yeah.
and how much of the foods and things get you to that,
Right.
into that management situation. Okay. Okay, so the next one is, now we're going to start kind of shifting over a little bit into a little different mindset here, where we have functional management. All right, so functional management is nutritional management, emotional management, energetic management, things like acupuncture, chiropractic, herbals. This is where instead of we're managing it with medical remedies, we're managing now, we've learned to do this pretty well in my world of managing a lot of these things with nutrition. We have nutritional remedies and herbals and the oils and so forth. Some are curative, but some are just management. And we have a whole natural industry of that as well. I'm part of that, was part of it, is part of it. You know, it's just we look at it from a position where at least you have very few, if any, side effects from this, versus over here we have a lot of side effects and
Right.
dealing with toxicity and poisons and that kind of stuff. I don't know if the battery went dead in this or
Did it turn off on it? Did it turn off?
I might have turned it off.
Did the light go out?
Yeah.
Okay, you have the battery, Brian? He can click it.
Oh, there we go.
Oh, you got it? Okay.
Okay, yeah.
Oh, you can do it.
Okay. Okay, so, all right, so now let's talk about something that is, to a lot of people have not thought about it. Just to be honest with you, about reversal.
Yes.
is it possible to reverse things? We know some things heal and get better. We cut ourselves and things like that and it gets better. But I'm talking about some of these things that's like over here in this medical management area. Can some of those things actually be reversed? They don't like us to use the word cure, so much. Sometimes it's even a legal issue, but so we're using the word reversal. All right, so here I want to talk about some of those things that we see that are helpful in reversing some of these ailments: intermittent fasting, upper cervical chiropractic, detoxing the body, using iodine, which is kind of the new thing that we've really been researching and gotten into, for the purpose of identifying and removing impediments. All right, so, and I'm going to come down to the rest of it here in a minute, but let's go back to intermittent fasting. Let's just talk about that for a few minutes. I'm going to give you just a little synopsis of the book. In intermittent fasting, well, what is intermittent fasting, first of all? It's not there's all kinds of connotations that go with fasting. Like, oh, you mean I got to fast for 40 days, or 7 days, or 3 days? You can do all those things, and we cover that in the book. But generally what we're talking about here in intermittent fasting is basically skipping a meal a day. Okay, personally, I don't eat breakfast, I eat lunch and dinner. Okay, and that's about it. What's the point? Okay, it's not about, depriving you of calories, which a lot of people think, well, if I don't eat, I'm not going to get calories and all these kind of things. We're really not looking at calories in this context of what we're trying to accomplish with intermittent fasting. We're looking at insulin levels, managing insulin levels in the body. Insulin's a hormone, right? It's produced by the pancreas to manage sugar, right? So we know, because we hear about insulin and, some people have to take insulin, okay, to manage back over here in that medical management area. So it's about managing insulin. Why do we want to manage insulin? Well, insulin, in a nutshell, when insulin's high in the body, and insulin, every time we eat something, insulin goes up, right? To deal with the sugar and get it physiologically processed through the body. So when insulin is high, our bodies store. They store things. Stores what? It stores fat, it stores sugar, it stores toxins, and it stores inflammation. When insulin's low in the body, in the fasting state, our bodies burn. Burn what? Fat, sugar, burns off inflammation, and toxins. So the more we can stay in that fasting state, the better the body is in a mode of healing versus defense. Now we have to eat, okay, we do want to eat, we want to eat good food, and we talk about that. But it's good to rest the body, all right, to allow it to recover. And, that's one of the questions I ask all my patients that come in. Well, how many meals you eat a day? And, it's 2, 3, 7. A lot of people graze.
Yeah.
They eat all the time. They never go. The only time they're not eating is when they're asleep. Okay, which is good, but, by the word, breakfast, break, fast, right?
Yeah.
Break the fast, okay? My break fast is lunch, okay? So that's what we accomplish there, and we recommend that to most people in just about any kind of healing situation that we want to get into. It's also a good spiritual thing. We know all the spiritual attributes of fasting as well. So that's a critical element that I think we all need to look at. Even if we're not doing it all the time, we should be doing it somewhere along the line. Like I say, so what I do is basically what we call an 18-6 fast. I'm eating in a 6-hour window. I'm fasting 18 hours. I'm still drinking water. You can drink coffee. I put heavy whipping cream in my coffee, which heavy whipping cream is all fat. So fat doesn't break the fast, technically. Okay, so you can do that. Okay, so it's a great element of, especially when you're needing healing. Okay, so let's move on to the next one, upper cervical chiropractic. So this is something sort of new to me. I got trained in this last year. I spent most of last year getting trained in this. For those that don't know what that is, upper cervical chiropractic is a specialty of chiropractic where we're basically looking at the top two vertebrae and how they relate to the skull, all right? And how they, let me see if I can do this right here. So let me give you a little demonstration of this. This is a little model. This is the back of the skull, okay? First and second vertebrae. Through that, if y'all can see, there's a hole in here. I'll put my thumb through there, where the nervous system, the spinal cord, and the brainstem come down through that area. So everything that's communicating or trying to communicate from the brain to the rest of the body goes through there, with the exception of the vagus nerves, which are on the outside. All right. So this is very critical that this is open and flowing. All right, neurologically, and also from the aspect of the cerebral spinal fluid flow. Can you go, Brian, to the, I think it's the next slide. I'm going to skip one here. Go, no, the one with the picture. So one with the picture of the skull. I mean, of the brain. Go back.
Back more.
Back. Is it not on there?
Yeah, I don't think so.
Go out of this and you can tell, you can see all your slides.
Do you see a picture of a brain? That might be on there.
Left side there. Not from the beginning, go down, see if there's any.
Nope.
No, not on this one.
Oh, okay, all right, sorry about that. Okay, so anyway, yeah, I was going to show you a picture of a brain and basically how the cerebral spinal fluid flows around the brain and down the cord and up. And this is what happens there is that is how the brain gets nutrition through the flow of the cerebral spinal fluid up, and then toxins get out of the brain down through the cerebral spinal fluid. So it's important that flows through here. When this gets out of position, it creates like a kink. We'll call it as a kink, all right? And you cannot flow this cerebral spinal fluid flow as good as it should be. One of the big breakthroughs we've had in this area is that we have found, and we can see this now on these motion or in motion MRIs, that you can actually see the cerebral spinal fluid flowing in the brain, just like a pulse. And it's amazing what this picture looks like. I mean, you can actually see the brain pulsing in there. It's really wild. And so that's a very important aspect, because what happens if you're getting kinked here, you'll begin to get higher levels of pressure in the brain, and that can create all kinds of brain issues. Okay, so we're finding if you can free that up and release that and get that flow going in there, that we're seeing some reversal of a lot of brain things in the past, and I'll give you some examples in a minute, of some of these brain things that we are saying are non-curable or incurable. For example, one of the doctors I've worked with has had some amazing results with Parkinson's disease. So Parkinson's disease is caused by a buildup of what they call a tau protein, TAU, tau protein in the brain, because the brain can't clean itself, number one. Number two, with the flow of the cerebral spinal fluid flowing around, it's having trouble getting into the frontal lobe, okay, which is where all of that stuff takes place, and the dopamine and so forth. So what do they give Parkinson's patients? They give them dopamine, okay, which is a drug that typically the brain is able to produce that if everything's flowing good in there. So by releasing this in here and also detoxing the brain, which we're going to talk about a little more in depth in a minute, when you detox the brain or open this up so the brain can detox, it can start to clean this plaque out. Intermittent fasting is good for that as well, because you're not putting junk back in there, and eating properly, so we're not junking it up with sugar and those kind of things. So we've actually seen people that literally could not get up and down off of a table, for example, to be treated. To a year later, the guy's out playing golf, okay? And he's got all this documented on one of them he's working on several others. So there's some hope in those areas. And so if there's hope with Parkinson's, that means there's going to be hope with all kinds of other brain disorders, dementias, and that sort of thing. And by the way, while I'm talking about the brain disorders and mental illness, I don't know if I have this later in the presentation, I don't remember, but let me just stop and kind of explain a little bit what they're finding in that. There's a lot of people with mental disorders. I'm talking about schizophrenia, these bad ones, okay, paranoias, and these kind of problems. There's another study that came out of Europe, again, although there was a doctor at Harvard that participated in this. We think of, and generally in the medical world, we think of mental disorders as some sort of brain chemistry issue, right? So they give them antidepressants, they give them SSRIs, they give them all these different drugs to try to match and get the brain working again, right? Well, so they did this study over in France. They had a mental facility that had 31 patients in it, and they took them and they basically started intermittent fasting. They put them on just about no more than 5 grams of carbs a day, which you basically could breathe that in. That's how little it is.
Yeah.
They were giving them, they were feeding kind of in the carnivore to keto world. Carnivore is just meat. Keto is, true keto is just carnivore with a few vegetables. So for 6 months they fed these people that. Okay, these are people that, the 3 classes were schizophrenia, suicidal depression, and bipolar. Okay, these were people, they were drugged out of their minds so they wouldn't hurt themselves or hurt other people. They did this for 6 months. Guess what happened? In 6 months, 43% of them walked out, no drugs, normal. The other 57% walked out normal with a little medication, minor amounts of medication. What does that mean? What does that tell us? Well, our premise that it's a brain chemistry issue might be wrong. It's more what we call, it would be called a metabolic disease,
Right.
as is diabetes,
Right.
as is autoimmune, as is all of these things that when I was in school were taught are incurable. There's nothing you can do about it,
Right.
except take probably steroids, prednisone, something like that. Okay, I remember them teaching us about autoimmune diseases when I was in school. Hopefully you'll never get it. Good luck if you do. That was what we were taught. Well, this has totally been debunked. So the subcervical has a lot of breakthrough in there. And the thing that really got me interested in this, because upper cervical chiropractic has been around since the beginning of chiropractic. All right, but I never really got into it because it required a lot of X-rays and re-X-rays, and I don't like to X-ray people unless they're absolutely necessary. So now we've learned in the last 4 or 5 years that there's a different type of evaluation we can do through leg length testing, which is another way of measuring what the body is showing us, and we can also do it through muscle testing as well. And when compared against X-ray, it's actually defining more accurate because we're actually getting dynamically what the body's doing versus a still static picture. So it's been some huge stuff. So when I saw that, that's when I got excited. I said, I now need to add this to my repertoire.
That sort of answers what I was going to ask. Is I've been getting my neck cracked for 40 years by very good chiropractors. And what's different now that's making this earth-shattering, right? What's different about the neck cracks I've gotten all my life compared to this?
Okay, So that's a good question, and that was a question I had. All right, and one of the things is one of it is the way we adjust it. Number one, we do it, it's not a crack type of adjustment the way you do the upper cervical. It's more of a repositioning through some light, some people would call it a flick, okay, kind of thing. So that's one thing. The other thing is there's certain ways that those upper vertebrae move or subluxate that our traditional adjusting didn't address. So in some cases, not all, because the regular adjusting works and works well, but there's certain ones that if they are positioned differently, it takes a different type of an adjustment to get to it. Okay, so that's added another layer of how you actually approach those things. So it's a good question. Okay, so all right, so upper cervical chiropractic. Detox is next. I'm going to skip that one because the next one, iodine, has a lot to do with that. So iodine is a essential mineral that we all need in our bodies. If we didn't have iodine in our bodies, we would die. All right. So this thing, and we hear this a lot. People go, "Oh, I'm allergic to iodine." You can't be allergic to iodine. You would die. You may react to what iodine's doing to you in a way of detoxing, or you getting corrupted iodine, like what they give you in contrast media and that kind of thing, or sometimes in certain seafood, it can be corrupted. All right. So iodine is a mineral that has gotten a lot of disdain. We have, in this realm of deception, and in today's world, we know even people that didn't know, their eyes are being opened now to how much we have been deceived in a lot of things.
Right.
You know, in our foods, our medicine, our politics, all the different things. There's a lot of deception going on. Well, iodine is one of those. Back in the 1800s, iodine was the treatment for about everything that they knew, because that's all they had back then. But then they started doing the research. There was a lot of research done in the 20s, 30s, and 40s, the 1920s, 30s, and 40s, that showed what iodine was really doing in the body. But along came in the 40s is when this thing called pharmaceuticals started getting pretty popular, right?
Yeah.
So all of that iodine stuff that they were using, because iodine was the antibiotic of the day, it was the antiviral of the day, and all the different things that it was beneficial was being done with iodine. Well, when the pharmaceuticals came along, all that stuff got kind of swept under the carpet. There was a study that was done in error and became the gold standard that what they were teaching not only in medical school but in chiropractic school to us. Oh, you got to be careful using iodine. If you use more than the minute amount that they recommended you use, you're going to hurt people and you're going to destroy their thyroids and all these sort of things. Turns out it's not true. You know, that's another thing they say, you'll cause these autoimmune conditions, these things like Hashimoto's disease and Graves' disease. Turns out it's the 180-degree opposite of that. That iodine is what we're using to reverse those conditions.
Yeah.
So we have, and I've done extensive research on this. Now, everybody was given a card. It's not technically my business card, but on those cards, there's a QR code on the front and a QR code on the back. The QR code on the front, with the one with my name on it, will send you to a site on my website that is to a paper written on iodine by a doctor I know that wrote it, which is a synopsis of a book written by Dr. David Brownstein up in Michigan that is the consummate expert. He's a medical doctor. He's the expert and is the one that has kind of dug out this old research and put it out here in publication now. So there's a paper on there that is a synopsis of that book. And it goes through all of the benefits that we get when we take iodine. Okay, and I'm not talking about just a drop or two of iodine. We're dosing people pretty high, actually high dose iodine is what we're doing now. And so all of this, so it goes to all these benefits. It's about a 15-minute read, but it's worth it. It'll blow your mind. I'm telling you, when you read this paper, it will blow your mind. It blew my mind, and I know this stuff, right? So, for example, okay, not only, we know that iodine's good for your thyroid and all of that, but how about this one? Let me give you a couple of examples of what iodine does in the body. How about this one? It activates what they call the P53 gene in your body. Has anybody ever heard of that, the P53 gene? P53 gene is the gene, when it's active, we don't get cancer. That's put there by God, the P53 gene. Also, there's two other ones, P21 and P16 genes, that basically modulate abnormal cell growth in the body. What's cancer? It's abnormal cell growth, right? So they are, if for no other reason, we probably want to be taking iodine, all right? Iodine, as the one before that is the detox, it's an excellent detoxifier of the body. There's all kinds of detox programs and concoctions, and I've had recently, I've had a couple patients come in to me and go like, I'm thinking about doing this detox program, and it's by a doctor, y'all might know his name, I won't mention it. And they said, but wow, it's like $7,000 to do this detox program. I'm going like, what?
Oh my goodness.
Get a bottle of iodine and get going. $18, okay, for a bottle of iodine, okay? And what we do is we dose them up, and that starts moving toxins. One of the toxins that moves the best is heavy metals. All right, heavy metals, and mainly mercury. Mercury is everywhere, and it's in our bodies, and it is hard to get out of the body. Okay, remember I worked in a chelation clinic where we were removing, plaque, but also the purpose of chelation was to get rid of heavy metals in the body, lead, copper, all these things that get overloaded in the body. But mercury was a hard one to get out. In fact, we had to use a different chelating agent, some stuff called DMPS, that we had to use to get mercury out. And even then, it still didn't work very well. Iodine dumps it. Man, you get it up in a high enough dosage, it'll dump it. And I can prove it. I saw it with the Kess machine. When I started high dosing iodine on myself, I started, I'm always experimenting on myself with stuff anyway. So, I'm still alive anyway. But anyway, so we started seeing mercury dumping out of my body that, wasn't showing up on previous tests. So we know it was moving it, okay? And we also saw, not immediately, and actually this was kind of the later, just maybe in the last month or 6 weeks or so ago, my brain was dumping, we saw it on the Kess machine, was dumping thimerosal. Does anybody know what thimerosal is? Thimerosal is the mercury preservative that they put in vaccines.
Oh, there you go.
Okay? Now, I believe they've just, with Robert Kennedy and his thing with the MAHA movement, in the government, I believe they have, I should have checked on this to make sure, but I believe they've banned that now. Which if they ban that might be vaccines, and that's another story, but they could be on their way. But anyway, so thimerosal. Now, wait a minute. I haven't had a vaccine since I was probably 6 or 7 years old. This is the last time I could probably remember doing any kind of vaccine. Because first of all, back when, and some of y'all remember this, back in those days there weren't that many of them, number one.
Right.
And number two, I don't know, we just probably didn't get them all, But here I am, 60-something years later, and now I'm dumping thimerosal that's been in my brain for 60-something years. Crazy, crazy. So,
What's the iodine that you use? It's a
we
specific.
use a product called Iosol, which is actually the famous one is Lugol's, okay? But Lugol's has potassium in it, and when you high dose potassium, you can get into some trouble there. So Iosol is the product we use that is it is ammonium iodine. And you can't overdose on it. People go, oh, you can overdose. No, you don't. You just pee it out if you get too much of it in your system. So you can't really overdose on it. All right? So, so it's a great way to detox, all these other benefits that it does. It's really good for cellular integrity, to build the cells strong. It's good for the mitochondria, which are the little energy makers in the cells. So there's a lot of good benefits with that. So these are just some of the things, just some examples. I could go on, we could do a seminar a week on all those kind of things.
Dr. Goolsby, I take that ISOL,
Mhm.
and I also work in the healthcare. And in the morning, I can feel that, I'm catching a cold or something, or my throat starts getting sore. I'll take that in the morning, the ISOL. I'm good.
Yeah.
Come on. So,
Yeah,
so
they-
it really is helping like for the flu season.
Well, I know you work in a hospital, and well, what do they do? What do they paint on you before they
Betadine.
cut you up? Betadine. What's that?
Iodine.
Right, right. So they've been using it all the time as an antiseptic or antibiotic, antiviral, has antiviral, antifungal, it's anti-everything, just about.
Yeah.
You know, that we can get into. It's really, I'll tell you, when you read this paper, please, y'all, read this paper. It's just gonna amaze you what and how all this works. So, okay. So, so a lot of what we do in our office now, and I think about this different, and we're gonna move into this divine health area here in a minute, and how we bridge the gap of all that. That's kind of my goal of this talk today, is how do we get from that up there to this down here?
Right.
All right. So a lot of what we do is we're trying to identify and remove impediments to our healing. All right. We all know, we've heard already from the previous speakers that we have all that we need within us to heal, that was put there by God and activated through Jesus Christ, right?
Right.
All right. But even to the non-believer, these bodies still heal.
Yes.
And let me prove it. If I cut my skin, and if I just keep it clean, what's it going to do?
Heal.
It's going to heal. Do we have to pray about it?
No.
Do we have to,
No. Pre-programmed.
call on whatever, No, it will heal. So it'll heal for the believer. It'll heal for the non-believer. It'll heal for the atheist. He could be cursing God and it'll heal. Why? Because it is in us already,
Yeah.
as we've heard, put there before the foundation of the world, right?
That's right.
It's part of our identity,
Yeah.
is we have this ability to our bodies to heal if we can get some of these, in our case, from a doctor perspective, can we get some of these impediments out of the way?
Right.
Whether it's our diet, sugar, junky food, chemicals, heavy metals. We're inundated with these toxins and stuff all the time in our environment. We go out and breathe the air, we're breathing car exhaust and all,
Yeah.
all these things we end up in our body. Now, God has also made a system of elimination of these toxins as well. But today we're just inundated, and we're also shooting ourselves in the foot as well, or maybe in the head even, I don't know. But so these impediments, so that's why in my office, I've tried to hone it down. There's all kinds of remedies and all kinds of therapies and things you can do, but I've tried to hone it down to the things that we can get the most effect of, all right? Chiropractic, upper cervical chiropractic, the codes, the Kess machine. So these are the different things that we utilize in our office to try to identify impediments and then figure out what do we got to do to get rid of it, whether it's fasting or supplements or adjustments or emotion code or those sort of things, so we can be made, we heard that word last night, whole. Okay, so we can be made whole. And then, get the information and learn how to maintain that level of health. Okay? So, in this realm of, we have all we need in there. and I've got a whole quote up here. I've heard it said that if it's not genetic or dead, it can be revived. Okay, I'm talking about in the physical body. And even now, we're learning in the genetic realm that there's this, you can actually affect your body genetically how it works. And it's because genes act and react to things. I'm trying to think of the word epigenetics is what they call it. That's is the word, right? I was going to ask you because I heard that in your book too. In epigenetics, we can control our genes to some degree. All right. I use this example. Let's say we got the meanest pit bull dog in the state sleeping over here in this corner. All right, we're having a meeting here, and we're all fine. It's peaceful. It's quiet. Let's use that as an analogy that dog is a gene. All right, a gene maybe that causes you to be sick or something going on, right? So I take a stick, go over there and whack him over the head, wake him up. He's angry now. Now he's running all over this place, this room, creating havoc, biting, cheering people up, blood everywhere. You know, that's kind of what epigenetics covers. All right.
Quantum.
So yeah. So if we know what to do to keep that dog asleep,
Right.
you know. And in fact, some of these things we mentioned here, these things that keep inflammation down in the body, keep the body and the cells working properly and healthy, then we can keep that dog asleep, okay? And now they're talking about, like Rochelle, I think it was Rochelle that talked about, or was it, and I don't know, about how, you know, we, by what we say and what we do, can actually affect on DNA. Because in school we're taught, like, hey, you got your DNA, it is what it is, and you are what you are, and that's it. Well, now we're learning that may not be totally true, all right?
Right.
So there's another doctor that I consult with and work with from time to time, and he has these what he calls the four general simplistic rules of physical healing. You know, I like simple things. I like to, you know, let's get to the chase. Let's figure out what do we need to do here. You know, I like the simplicity of the gospel. You know, we get all this stuff. I like the simplicity of the gospel. So basically, he says that if you can, I think I got a note here on this. I want to make sure I get this right. I think I got it anyway. All right. So he basically says if you can detox the body, get the body cleaned out, using iodine to clean out the body, keep the upper cervical flowing so you're getting good communication from brain to all of your organs and body and tissue, all right? Eat a good have a good nutritional platform, all right? So that your body can have the fuel that it needs to run properly. And let's see, did I mention 3 or 4? But anyway, that's kind of the basis. If you can keep that operational in your body, the body can then heal itself of anything because it's put there. Okay, because that's what we are. All right. So how are we doing on time? All right. Okay, so like I said, kind of the goal of this was I wanted to get into how do we get from here to here.
Right.
Okay, how do we walk in divine health? Okay, these are some of the practical things that we deal with in our physical body, going to doctors and that, but how can we ultimately get over into this divine health realm, and how do we walk and live more in that area? Okay, want to go to the next one, Brian? Okay, thanks. So what I did here, and we'll talk about this, but I just put together some things to consider in this realm, and we've heard a little bit about this already from the previous speakers, but belief. Okay, what do we believe? You know, going back to some of those things about, the diabetes I was talking about, and do I believe that I could do this or do that and help this or take care of that situation, or no, that can't be. I don't know what he's talking about. I've never heard of that before. So what's your belief system? And we know, we've heard that life and death is in the power of the tongue. Spiritual, this is what Annette Capps is really good at, is spiritual realities are voice activated. Voice activation brings into what is done, what Jesus has done, in the spirit to done here in the natural.
Yeah.
All right, so we bring the done there to done here, right?
That's right.
We heard about quantum physics, so I don't have to explain what that is. Annette Capps did a great job on that. That's one of the best I've ever heard, actually. Quantum physics, I believe, this is my belief, it's God's physics. Because most of this stuff in the quantum physics world operates in the unseen world.
Right.
And we're all trying to get a better idea of what's going on in that unseen world. What are we seeing? What are we not seeing? What's going on? You know, we saw some and heard some examples of that. And then what I say, I've always thought this, that quantum physics kind of proves what God's doing in the natural world. Because a lot of that stuff becomes spoken into a natural form that we can actually see. Okay? And some of the examples, and some of these have already been used as like, an example is prayer at a distance. How can I pray for somebody in Australia? And, you know, it works.
Yeah.
You know, they get, you know, how does that work? Oh, it's just faith. Yeah, but how does that work? I mean, I'm a scientist. Maybe I ask too many questions that way, but how does that work? And that's that entanglement, whether it's, some people call it quantum entanglement, some people call it spiritual entanglement, but it is a system that's made by God for us to utilize and tap into. Unfortunately, some people just cannot get there with that. But we have the examples in the Bible, the centurion and prayer and that. So voice of belief can change the molecular structure of things. That's what Annette Capps was talking about when she said that nothing is anything until it's observed.
Yeah.
All right? That's just hard to believe, you know, because we'll believe it when we see it, is how the world kind of works. No, I don't believe that. I'll believe it when I see it. No, it goes the other way. You can create what it is you're to see.
Yeah.
And that's the realm of quantum physics. I just read something the other day, you know, scientists don't like quantum physics. You know why? Because they can't control it.
Yeah, that's right.
Regular science and experiments, you know, when you in school, you do all these lab experiments, you mix this with that, and it makes this or that, and you know what it's doing. Quantum physics, prayer, faith, all these kind of things, they cannot explain it, and therefore they can't control it.
Yeah.
And there's always that controlling spirit that
Yes.
seems to always want to be involved in just about everything. There's that controlling spirit. So I thought that was quite interesting. Okay, so what's the greater reality? When we bring spiritual realities into the healing process, all of the previously mentioned things that we talked about become much more effective in removing impediments and releasing the healing power that is within us. So it's a great tool that I have in my office from an evangelistic point of view. I think everybody would probably agree with that. Even maybe non-believers, I think, would maybe agree that, yeah, there might be a God thing in there somewhere, or the good Lord will do something, you know, and that. So it's a great point of contact for the non-believer even to say, you know, look, you know, God made you this way, whether you believe it, like it or not. You were made in the image and likeness of Him before the foundations of the world. That's the truth.
It's the truth.
Now, you may not believe it. You may not be to that level yet. But again, the seed gets planted there. So it's a great kind of evangelistic tool that I use when there's that opening. And then if they want to know more about it, I had a patient the other day, about 2 weeks ago. She goes, and I know she's a non-believer, and she goes, do you mean that? Is that like sort of like quantum physics? I go, oh yeah, you know about quantum physics? And she goes, oh yeah, I read about this stuff and this and that and everything. And so the next question I ask is, well, who do you think made all of that?
Yeah.
Well, it's just the way things are. I said, well, God made that. It's all His design.
That's right.
It's how, I think I read it somewhere that the quantum physics is how, let's see, I don't know if I can remember this exactly, but basically quantum physics is what He gave us, or one of the tools He gave us to operate in this world we live in here today.
Yeah.
You know, even though it's unseen and all that, it's kind of a bridge maybe.
It's a bridge.
So,
You're right.
so there are, so those are some of the ways that we can open some doors, because some people have some beliefs about something somewhere. So if we can tap in, or find that, then it gives us a great tool to be able to then expound on some things from there. Let's go to the next one, Brian. Okay. Yeah, so I asked the question, how do we get from the beginning of that chart down? We know that we already have everything we need within us to create healing. God made these bodies to heal. I used the skin example already. So the question then becomes, can we get our mind renewed to these things, to these thoughts? That's where we have to do the work.
Right.
As far as, not that we have to do something to get something, but what am I thinking? What am I believing? Okay? Mindset and belief system, is it even possible based on our experiences? Our experience in this life, and I don't know whether everybody can attest to this, but I think, unfortunately, we see more failure than reality of healing. We've all prayed for people, we've seen people get healed, but then we have the ones that didn't. And we and then we see another one do it, and we see another one, and then we begin to lose our fervor to pray for healing. So that needs to change. We need to change. I thank God for what we heard last night and some other stuff that we're studying and looking at these days, that I think that's changing more and more all the time, because we're understanding how a lot of this stuff works. As a scientist, that helps me, because I like to know kind of the schematically how some of this stuff works. But even now, we can't get there because it's in that unseen world. Okay, so that's a question we all should ask. Is it even possible? Oh no, I've seen a lot of failures. I've prayed for people and they haven't got well, and I don't know whether I should keep doing this or not, or I lose my faith, I lose my fervor for that. Okay, so we know that a good positive mindset strengthens the immune system. They've proven that over and over and over and over. And in my career, I use cancer survivors as a example. We've seen a lot of people die of cancer. We've seen people survive of cancer. But the one common denominator that I've noticed in all my career is that they all have great attitudes, despite the therapy that they were getting, despite the type of the therapy they were doing. Whether they were doing natural things, whether they were doing chemotherapy or anything else. I think a lot of times the mindset overcomes the negativity that's being caused by some of the therapies that people get. That's hard. I'm telling you, that's hard for me to get my head around, because I know what the stuff is doing. Part of the problem is I'm a doctor and I know too much sometimes. And I know what's going on, and I go like, that's not going to work. You can't, that's going to kill you. And so that's stuff that I'm struggling with and becoming more and more. These are questions for me as well. Okay, let's see, do I have another page there? Yeah, I do. Yep. So let's go to the next one. Yeah, so here's some more thoughts to ponder here. And we heard this, I think, a while ago as well. If thoughts can make you sick, we know about the psychosomatic effect, right? If thoughts can make you sick, then they can also make you well. Right. What do you believe? What are you saying? What are you talking? Okay? The next one is a subtitle to a book that I read, and that have the title of the book, and then it's called Thinking Your Way to Chronic, oh, I got two chronics in it. Thinking Your Way to Chronic Health.
There you go.
Okay, we always hear the statement, you're thinking your way to chronic sickness, right? Okay, how about thinking your way to chronic health?
Yeah, there you go.
All right. Okay, we know about the laying on of hands, and Rochelle mentioned that, and I'm privileged every day that I work to lay hands on, 35 to 45 people a day that I get to lay my hands on. And I'm going to get down here in a minute what we do with that. So we also have, the scripture, the famous scripture in 2 Peter 1:3. We have been given all things that pertain to life and godliness, all right, which includes healing. All right, so we have that in there. Knowing who we are and what we have in Christ and how to appropriate and release it into our lives. When I started getting into all this a few years ago, I changed the way I pray for people. It used to be, oh, Jesus, come and do something and, this and that. No, I don't pray that way anymore. I pray this, release what it is they have in them to heal.
That's good.
You already have it. Whatever that impediment is, cast that thing out. If you want to cast something out, cast that out. Release what it is they have in them to heal. I'll be standing sometimes at church, standing and praying for somebody, and I'm praying that way, and I hear somebody over here praying, oh God, do something, touch this person. And he did it already. He already did it. He did that at the cross, right?
Amen.
And then released it. I did skip one thing I wanted to mention, but I'll go back to that in a minute. All right, so I converse with a group of doctors regularly that think and operate this way. They're believers, they're spirit-filled believers, and we talk this kind of talk all the time. There's 4 or 5 of us, and we're talking about these kind of things. I give a couple of examples here. Y'all know who Dr. Ben Carson is?
Yeah.
Okay. So Ben Carson is probably, or was, he's retired now. He was in Trump's administration, his first administration. He was a world-renowned, probably the best pediatric neurosurgeon in the world. Okay. I read all his books way before he was famous. His story is just amazing how, because he came out of the ghettos of Detroit and became, this amazing surgeon. And one of the things, the way he did, he was quite innovative in neurosurgery. I mean, he created techniques, he did certain surgeries that were impossible to do, and he was a prototype for a lot of amazing things in the neurosurgical world. And one of the big famous ones he did was the conjoined twins. You may have heard of this, with the conjoined twins at the head, and was able to separate the 2 brains, which is impossible, but he did it. He figured it out. But one of the things that really stuck with me that I read in his book was that he would be in surgery sometimes and be in the middle of some kid's brain doing something and would be stuck. He would come up and go like, I don't know what to do next. I've got to do something. This kid's going to die. I don't know what to do. And he would just go, Lord, show me what to do. And he would get the answer, and he would go on and be a miracle. And he did this over and over and over. And that's what he relied on, and that's why he did these miracles. He just became the vessel that we all talk about, being the vessel.
Yes.
All right. To do his miraculous work through us.
And doctor, wouldn't that be quantum entanglement?
Yes, it would be.
Sure.
Aligning with God? With
Sure,
his-
absolutely.
By the Spirit?
Yep, absolutely. Yeah, being entangled, getting that download, getting that, only the thing that he could see and do, right? The next one is Dr. Craig, one of the other doctors I was talking about. I was up in his office probably back in the summer, I would imagine, just observing and watching him work one day with the upper cervical work. And he comes over, and he had another doctor there that was doing some work, so he was working over. He walks over to me, he takes a piece of paper and jots down the scripture, and I should have wrote it down there. I believe it's in, it's the one that lay hand on the sick and they shall recover. Okay, I forgot. I think is that in Matthew or 4:16? Mark 4:16. Yeah. Okay, Mark 4:16. And he says, "This is what I do on every patient. When I go to lay hands on them, they might, they could, no, they shall
Amen.
recover." Okay, so then I was talking to him on the phone a couple weeks ago. I said, so you wrote that thing down? I said, that was amazing. I'm doing that myself now. But what do you think is really getting the job done? Do you think it's that prayer you're praying, or is it the technique that you're applying? And he said, yes, both, because I'm being the vessel, but also applying the technique that is being inspired by him.
Yeah,
You know?
that's right.
So I want to be associated with people that think like that,
Yeah.
and talk like that,
Amen.
and believe like that. That's the same guy, by the way, that's getting all these miracles with like Parkinson's and some of these other things that he's doing with, and is quite innovative and is discovering and doing a lot of this new innovative work in upper cervical. All right, and we have, and I know other doctors that are working that same way. Why? Because we know the healer, okay? And we know that we heal nothing. We of the flesh know nothing. We know we are just vessels endowed with some skills and knowledge to remove impediments and release the healing potential already resident in the body. That's our belief system. And that keeps us hopefully on the side of humility and humbleness.
Yeah.
Because we doctors know a lot of stuff. And we've been taught a lot of stuff. We've had all this education. Just talk to some doctors sometime and they'll tell you about it.
Yeah.
Okay? They'll let you know. And part of them are some of these guys that are like these neurosurgeons. Oh my gosh, they're way out. Because really the knowledge they have is like incredible. But a lot of them are pretty, they believe it. So, anyway, all right. Let's see.
Make sure that anybody's writing that scripture down. It's Mark 16.
Mark 16.
Yeah. That particular verse is like.
Okay, yeah, Mark 16. Okay. There's that is, skipped a line to that I added in here. I did want to go over that. I wonder what happened to that. Okay, it was actually under the line, if thoughts can make you sick, they can also make you well. One of the questions here that I posed in this list of questions here is, can we stay focused?
16, 17.
So it is 16, 17, okay. Can we stay focused on the immense, I'm talking about the immense, not just a little, the immense grace, glory, power, and the love of God that was released into this earth by His Son? Some people call that hyper grace, which some people are like, oh my God, what are you talking about? Well, I'll tell you who talked about it. It was Paul. Because Paul said 5 times in the epistles, he used a word, and the word grace is actually translated in hyperbalon. You probably heard this right? 5 times he used the word hyperbalon, which is a word that means excess, beyond, surpassing, and exceeding.
That's good.
All
That's
right?
good.
Grace.
Yeah.
Gosh, in the church today, we can't even agree on grace.
I know,
I mean,
right?
it's like, now we're talking about hyper grace. Oh man, now you're going to be a hyper sinner. It's like, forgive me on that one. Okay, I'm working on that. Okay.
Let it go.
So can we get our minds wrapped around the immense, our hyper grace, the hyper glory, the hyper power, and the hyper love
Yeah.
of God?
Amen.
Yes.
I want to get there and be there.
Yeah.
Because I think we're untouchable when we get there.
Yeah. Yeah.
As we're getting there. And you know what it says? It says receive it. Romans 5:17, right? Those that receive the abundance of grace and the gift of righteousness shall what? Shall reign in life with one Jesus Christ.
Yes.
Shall reign in life. Reign over what? How about sickness?
Yeah,
How about finances? How about whatever?
whatever.
Those that, you don't have to work for it, those that receive.
Yeah.
Emerson was talking about that last night, about receiving. Just receive it.
Yeah.
Just receive it. Okay. So, so I'm going to switch gears here for a minute, and I'm going to kind of plug something that we're up to right now, because there's such vastness of information right now. And like I said, I've been in practice for over 40 years, and I have a lot of information, a lot of stuff in my brain, a lot of different things that help us in our walk with health and mending it with, or blending it, I should say, with the Word of God. So, Brian, if you put up that next slide there. Yeah, that one. So, me and my team have been working on a resource, and I'll just read it there, a resource hub that provides practical, proven guidance for optimal health. All right? This is going to be, and it's called AHA, okay? And we came off of AHA stands for Adaptive Health Approach, and it's an offshoot of MAHA, okay?
Okay.
You all know what MAHA is?
Yeah.
Okay. Make America Healthy Again.
Yeah.
So we're working as we speak on a source. This is going to be, it's going to come off of my website, where we are putting together, let's go to the next one there, Brian. We've already recorded over 50 videos of myself explaining different issues that we have. Okay, here's just a sample of 6 of them: brain and memory migraines, energy metabolism, gut health allergies, heart vascular health, hormones, mobility and movement. Why are we doing this? I'm one man, I can only see so many people, I can only do so much. A lot of things that I see, if people had the knowledge of what to do with it, a lot of these things they could deal with them at home. Okay, they wouldn't need to visit me. So that's my heart, is to get this information to where, and it's somewhat intuitive to where it'll take you to different places where you need health. We're going to have videos. I'm going to be doing either live or pre-recorded question and answer sessions, at least monthly, maybe more than that. We're going to also, one of my team members may become more active in this, she's a mother, and it's going to be addressing pediatric issues, because mothers, my kid's got a sore throat. What should I do? Should I go to the doctor? Should I do this? Well, why don't you try this first, see if you can get some help there, and if not, then we can get you to the doctor or what have you. So we're just trying to get this information. There's also going to be a lot of what I call pearls, stuff that I have discovered, stuff that other doctors have shown me that I've discovered that a lot of people don't know, a lot of doctors don't know. Certain little techniques, like I do a technique on hiatal hernias. And I mean, I have doctors around here that go like, oh, that's impossible. No, we do it every day. Things like that. So this is going to be a resource for that. It's going to be a membership-based resource. For less than half a visit to my office a month, you can join up with this. Now, it's not live yet. It's our launch date is going to be hopefully December 12th, 12/12.
That's good.
On the cards that you got, on the other side, which is the AHA side, there's also a QR code there that you can click on. Go to the next slide, Brian. Okay, and there's basically just be the first to know when we've gone live. Okay, if you want an update or would like to know more about this, we'll just give you an email. We're not going to send you a bunch of junk on email and stuff. We're just going to let you know, and then if you look over it and it suits your taste, then you can subscribe to that. So that's what we're going to do. We're going to build. It's going to continue to build. It's not going to be just those 50 videos or so we've done. We're going to continue to put new content on there all the time. on the cutting edge. I'm a cutting edge kind of guy. I like to stay on the cutting edge of what's working out there. And that's why, last year I went and did upper cervical. Next year, I don't know, whatever God's got, I'll do it next year, or maybe there won't be. Every time I think I've kind of arrived at what I want to do, forget it. And I appreciate the word earlier by Keith over Rochelle and I, that because I was right on. It's just actually, Keith, what you spoke over us was just a confirmation of what we're seeing. We have these conversations a lot. Like, God's going somewhere with us. We're taking us somewhere. We know we're not finished, and so it's going to require us to be in good health. We're in our 70s now, and it's going to require. And you know what? You know who can do it? God can do it.
That's
Right?
right.
And that's what we're leaning on. And
Yeah.
we love it. We love what we do. Most of my contemporaries are retired or dead, unfortunately, and we're not. We have no aspirations of doing that. So if this is interesting, I think that it's going to be different than the other thing we're going to do. I didn't mention is this is all the physical stuff, but we're also going to begin to integrate the spiritual side of that. A lot of the beliefs, and start talking to people about not just, hey, here's a remedy to fix this. Let's start talking about, knowing that you've got a healing, you've got what you need to heal in your body. And number one, you'll find that out. Number two, how do we activate that, and how do we make that to where we can walk and stay in health all, for the rest of our lives. And so we can finish strong, finish like Moses, and who knows what we can do as we age well, right?
Yes.
So
Yes,
we
that's very
got
good.
we got a few minutes. I think we're supposed to go to 1. So I'm done with my presentation. But if you have any questions, I'll be glad to do a little Q&A here for a few minutes and try to help you out that way. And so questions.
Any
Andrew?
questions, for 5 or 10 minutes?
Yeah.
Questions? Well, I have one. Does the iodine, I think in your presentation you talked a little bit about this, and I was putting together how it can definitely elongate your life. Is there anything that's said about it that it affects the telomeres?
I think I did see something somewhere. I read something that it does affect them, or at least slow down the deterioration of telomeres.
Okay, I was wondering.
Yeah, I would think because it would make sense because it's really good at improving the architecture of the cells, and of course telomeres are down in the DNA area, but it just it invigorates and helps all of that just work better. And there's a whole process of that. I don't have time to get into that today, but that's going to be in probably one of the videos somewhere of explaining how all that actually works, how the flow, there's like a flow chart of how iodine does that in the body. Yeah. Yeah.
Anything else?
Yes, ma'am.
Is there any contraindications at all for the iodine use?
Well, we always start out slow dosage-wise to watch for that. Generally, there's not. Occasionally, there is some sensitivity to it, but it's usually, a lot of times we find it's because of, there'll be a deficiency of either a couple of B vitamins that are needed, or selenium is also needed. But most of the time when people react to iodine, it's because their body starts detoxing. They start dumping real fast. And then that creates a firestorm, and then we have to back off and slow down. So that's our challenge all the time, is we try to push the envelope, but yet we don't want to push them overboard where they feel terrible. Okay? So.
Dr. Goolsby, can I tell them what happened to me when I came to you and you
Sure.
were able to help my health care?
Go for it.
Okay.
Yeah.
All right. I had Graves' disease many years ago. And Graves' disease is when your goiter has nodules that just overloads your body with thyroid hormones. It basically shuts off your pituitary gland. And you lose focus, and you could try to get across the room to just do one simple task. But as you're going across that room, you're like, oh my goodness, this cup is out of the way. Oh, this is out of the way. And you're jumping back and forth.
You tell my story.
And you're can't focus. So anyway, eventually I had it healed with radioiodine 131. So I had to go on Synthroid or the generic or Armor, which is a natural thyroid, and for years. Well, a couple of years ago, I had a healing in church, and I stopped taking the Synthroid, levothyroxine, the Armor, whatever, was out there for me to supplement not having a thyroid hormone. Well, after that healing, my faith was so strong, I'm like, not taking any more. So I did. So I totally got off of Armor. Well, I didn't realize that my body was eventually just deteriorating. When I went to Dr. Goolsby, and last year, I was cramping so bad because that happens when your body's depleted with the thyroid hormone. I hurt so bad. I was so slow that my daughter was saying, look, my mother-in-law is 70 years old. She's doing circles around you. And I said, well, I'm just getting old, honey. You just got to realize that Mama's getting old. And she said, no, this is not right. So anyway, I had a coworker saying not really nice words, but he basically said, what is wrong with you? And when I saw that young coworker tell me that, and I had other coworkers tell me that, I just blew them off. But when the young one told me that, I'm like, oh, I need to check this out. So I went to Dr. Goolsby. He put me on thyroid. It was the potassium thyroid. And I started feeling better. My clarity was getting better. I didn't cramp as much. Now it took about 2 months before that started really occurring, where I got rid of the cramps, I got rid of the fatigue, I got rid of the brain fog. And now I'm on the isosol. And I'm taking that, and I'm taking a few other supplements. But I tell you what, this guy helped save my life.
Amen.
Well, let's go. Let's give him the glory. Give him the glory.
Amen. I do, I give the Lord the glory.
Hey, Dr. Goolsby, can I say something?
Sure.
After, when you started doing the upper cervical on me, we noticed through God that I am starting to heal from all the toxins that are in my body.
That was an impediment. Yeah, Jerry had gone through a lot of stuff. We'd done a lot of things, and she got better, but it was still kind of dragging along. But then we learned another modality to remove another impediment, and then she began to.
And I am having the test done as well. Okay. And the codes.
Yeah,
You name it, I've had it all.
she's done it all. Okay, anybody else? Okay.
Hey, can you tell us what that iodine is for the group that you recommend?
Yeah, it's called, the product name is Iosol. We carry it in our office is the actual name of it. It's IOSOL. That's how you spell it. Yeah, Iosol. Yep. Okay.
Can you get that on your website?
Not yet. It's going to be there. Yeah. Yeah.
Quick question. With the ISOL, would you recommend only doing it under your supervision?
It would be better that way because, like Dr. Craig I was talking about up there, he won't give anybody iodine until they make sure that this upper cervical is open. Because if you give iodine to someone and they got toxins in their brain and that stuff starts trying to come out and it can't get through there because it's like a hose that's kinked, then you're going to have, probably not going to feel good. It's not going to like hurt you or kill you, but it's not going to feel very good. Okay, because you want these toxins, when they start moving, you want them out. That's why we want to make sure the liver's open, the kidneys are open, the bladder's open, the ileocecal valve, so you make sure you're eliminating correctly. We want those toxins out of the body. We don't want them recycling and recirculating. It's one thing that it's great if you can move them, but we've got to get them out. Okay, so, all right. Okay, all right. Is that good? Are we good? All right.
Wonderful. Wonderful. We're so blessed to have